Hello, everyone. My name is DenisGomez, and today I will be presenting the organization, cybersecurity policy, and executive summary. The cybersecurity framework implemented at our hospital is NIST. In the protection function, Augusta is dedicated to performing identity management and access control, awareness training, data security, and the use of protective technology to safeguard patient health information. In the detect function, Augusta is dedicated to performing continuous security monitoring and has established detection process. In the response function, Augusta has implemented an incident response plan that will help with response planning, communication, analysis, mitigation, and improvement. In the recovery function, Augusta has decided to reduce the impact of a cybersecurity incident by establishing a recovery plan, improvements in communications. Augusta Medical Hospital has decided to implement Tier 4 of the NIST cybersecurity implementation tier by prioritizing cybersecurity investments to protect the patient's health information and the operation of the hospital. In the risk management process, Augusta plans to adapt its cybersecurity practices based on the previous and current cybersecurity incidents by applying lessons learned to continuously improve the resiliency cybersecurity posture of the hospital. Augusta considers organization objectives and highly considers them when making cybersecurity protection decisions. Augusta Medical understands its role, dependencies, and independence in the medical system and is committed to proactively protecting the hospital system and PHI information and increasing the resiliency of hospital cybersecurity posture. As mentioned previously, the cybersecurity lifecycle implemented at Augusta Medical Hospital is the NIST, which includes identification, protection, detection, response, and recovery. In the identification phase, we will classify data to identify the critical data that must be protected from hackers based on the sensitivity of the information. Data can be classified as private, public, and restricted. Further, in the identification phase, the IT department, along with the IT security team, will create asset management of our hardware and software assets and determine their weakness and vulnerabilities. In the protection phase, the IT governance and the IT security team will deploy cybersecurity solutions and technologies to protect the network system and configurations based on the vulnerabilities identified. Additionally, regular mandatory cybersecurity training will be conducted to alert employees of the latest cyber threats and train them with the best cybersecurity practices to be prepared to be the first line of defense against any attack. In the detection phase, the IT security team will implement log management to review and analyze user and network behavior to proactively monitor any unusual activity. Further, we will perform in-house threat detection technologies via penetration tests that will help us evaluate the threats and their likelihood to occur. In the response phase, the leadership team, along with the IT governance and IT security team led by the CISO, will implement a cyber incident response plan that will define the actions to follow under an incident to mitigate risk and recover control. The incident response management team is conformed by all the experienced personnel that will work together to run the plan. In this step, it is vital to purchase cyber insurance to protect from any damage to the assets of the organization. In the recovery phase, the leadership team and the IT governance team will ensure to establish a business continuity plan to ensure the organization is operational after any incident. The goal of this plan is to restore the systems and operation of the organization as efficiently as possible from any disruption. The plan will assess the criticality of events based on the financial and operational implications the incident might cause to the organization. It is ideal to implement a plan that will reduce any downtime to make the information available for the organization as part of the CIA triad. The organizational security policy will be implemented with the assistance of the American Health Information Management Association to comply with the HIPAA and ISO standards. The organizational security policy will consist in signing an acceptable use policy that will include details regarding company devices, mobile device management, and user license agreement, CIA according to HIPAA guidelines, encryption, internet use, and VPN. Second, the newly hired employees will receive on-the-job training, HIPAA compliance training, information security training, policy training, and cybersecurity awareness training to understand what behavior is expected from them by the organization. The terminated employees will receive final paperwork and exit interviews to discuss what is expected from them after leaving the organization. Third, the employees are not allowed to include Augusta Medical Hospital on their handles, usernames, or URLs, and are not allowed to use social media during working hours unless authorized otherwise. Employees are allowed to use social media during their breaks, however, they must not violate the social media guidelines of posting hospital-sensitive information, PHI, or workplace photographs. Fourth, to mitigate the risk of insider threats, Augusta Medical Hospital will update its cybersecurity policies and procedures regularly, implementing the least privileges principle and role-based access control. Fifth, all employees using company devices or BYOD devices must enroll in the mobile device management to protect the CIA of PHI. 6. Augusta Medical Hospital will comply with the ISO 27799 and 27011 standards, HIPAA privacy rule, HIPAA security rule, HIPAA enforcement rule, and HIPAA breach notification rule. At Augusta Medical Hospital, we will implement a network diagram that contains a demilitarized zone, firewalls, IPS, IDS, SIEM, workstations, medical equipment, routers, and database servers, as well as VLANs in the routers. To prevent being a victim of several cybersecurity incidents suffered in the past, we will fulfill the following technical requirements: encryption, data backup, data storage, integrity management, access controls, and audit controls. Encryption is one of the most critical technical requirements at Augusta to protect PHI information in use, at rest, and in transit. To protect data at rest and in use, Augusta has made a requirement that all hospital devices have a BitLocker encryption and that employees password protect their files. To protect data in transit, Augusta has implemented email encryption for internal and external communications. Another vital technical requirement is data backups. Augusta will perform automatic data backups every week to ensure data redundancy of PHI and system information. Data storage will be encrypted, and employees should always save patient documents to the server storage. In the data storage, Augusta will use RAID 10 to prevent risk failure to ensure efficiency in the data storage of the hospital. To ensure integrity management in our system and PHI, we will install root certificates with SHA 512, the strongest encryption algorithm. In implementation, safeguard, and accessing controls, Augusta will ensure unique user identification, emergency access procedure, automatic log-off, encryption, and decryption. For audit controls, Augusta will use the event logs and notifications generated by the Security Information and Event Management, Intrusion Prevention System, and Intrusion Detection System. A qualitative risk assessment implements a set of methods, principles, or rules to assess risk based on the description, perceptions, and opinions of subject matter experts of an organization. The impact of the patient record system being under a cyber attack at our hospital represents an extreme risk because it will represent a catastrophic consequence to the organization with a possible occurrence. Disruption to the systems that contain PHI could cause delays in patient treatments that could affect our health. A data breach or sensitive information could cause the hospital financial and reputational damage. The impact of nursing resources being under a cyber attack signifies a high risk because it would represent a major consequence with a possible likelihood to occur. The impact of the case documentation being under a cyber attack is considered high risk because it will represent a major consequence with a possible likelihood to happen. The impact of the patient record databases being under attack is considered an extreme risk because if it were to happen, it would represent a catastrophic consequence with a possible likelihood. The impact of the digital medical imaging systems being under a cyber attack is considered a moderate risk because if it were to happen, it would represent a major consequence with a rare likelihood to happen. When performing the business impact analysis at Augusta, we first identified the operating and staffing costs, which include the staffing salaries, $1,500,000, operational monthly budget $500,000, and the innovation monthly program $150,000. The direct costs include materials, hospital equipment, health care staff salaries, and intervention costs. The indirect costs are the related costs needed for the patient to undergo an intervention and treatment. Our total monthly operating costs are $2,150,000. The total average number of patients treated each month is 3,200 patients. The total cost per client at our hospital is $672. Our business continuity plan would ensure confidentiality, integrity, and availability in data backups, disaster recovery plans, emergency mode operation plans, testing and revising procedures, and critically assessing procedures. For the disaster recovery plan, Augusta Medical would have at least 2 internet paths, 2 internet providers, and a hot alternate site in case of an event that causes prolonged downtimes. A hot site is an office space prepared to operate the hospital with the necessary system hardware, supporting infrastructure, and support personnel with high availability uptimes, ready to be used in case the primary site fails. The alternate site will be located no more than 50 miles from the primary site, and it will be tested at least quarterly to ensure availability. For the emergency mode operation plans, Augusta Hospital would maintain an electric generator, test the generator monthly, and maintain at least a week of fuel for the generator. Lastly, healthcare staff will use a backup communication strategy in case the primary communications, such as email and instant messaging, are unavailable. For the testing and revision procedures, Augusta will train and test staff on the established contingency plan developed by leadership and the IT department. and training, we will ensure that the contingency plan is validated with certified testing. At our hospital, we will follow the procedures of the NISC Incident Response Plan, which are preparation, detection and analysis, containment, eradication, and post-incident activity. We will prepare by establishing incident handling, communications, and facilities such as contact information, incident report mechanisms, and issue tracking system, smartphones, a war room, and a secure storage facility. The second step when performing incident handling is to detect and analyze. During this phase, it is vital to understand attack vectors and signs of a possible incident. Attack vectors include removal of media, web applications, emails, phishing, employee negligence, employee ignorance, and physical theft or equipment. The third step is to contain, eradicate, and recover. Next, the incident response team must gather evidence for legal matters to understand the complexity of the incident. Chain of custody must be implemented when different members of the team transfer their evidence that contain device information, the individual who collected the information, time, date, and location where it was stored. Following the evidence gathering, the incident response team must strive to identify attacking hosts by validating the attacking host IP address using incident databases and monitoring the attacker's communication channels. The fourth step is to include the post-incident activity. During this phase, the incident response team will document lessons learned, apply any additional security measures, identify evolving threats, and implement new security technologies. The team must document what can be done better next time to prevent the same incident or related incidents from happening. In the cybersecurity awareness infographic, we have included information regarding the risk of internet use, the risk of Internet of Things, the risk of data protection for intellectual property, the Open Web Application Security Top 10, the mobile device risks, and methods to implement security controls for web applications. At our hospital, we're committed to protecting our patients' health records by implementing preventive, protective, and responsive cybersecurity and organizational security measures. We have decided as an organization to use the NIST cybersecurity framework: identity, protect, detect, respond, and recover. We're committed to complying with HIPAA and ISO standards to ensure the confidentiality, integrity, and availability of our hospital and patient information, including the ISO 27001, 27799 series, HIPAA, privacy, security, and enforcement rule, along with the breach notification rule. We're committed to update risk assessments, business impact analysis, and business continuity plans as emerging threats arise to better protect our organization from any zero-day attacks. We will proactively update policies and procedures to safeguard our patients' health information and minimize the attack surfaces that could lead to a data breach. At Augusta Medical Health, cybersecurity is our priority and is a critical hospital operation. And as the steering committee, we will seek to protect the well-being of our members and employees. This was the organization's security policy and executive summary.